Hello, everybody, and welcome to today's presentation. For those of you who don't know me, my name is Dr. Brianne Callanan, and I am the host today on behalf of Health Buddha. And joining me today is Dr. Lisa Adams, who is a naturopathic doctor and cheerleader for women's health and happiness. Her practice expertise developed over the last 15 years of working and inspiring high-achieving women to look and feel energized and have clarity and calm in their daily lives. She has a clinical focus on fertility, pregnancy, and children's health, as well as creating hormone harmony throughout a woman's life. Inspired by her own many health challenges throughout motherhood, she has become a passionate individual about helping women to transform fatigue and fertility fears into feeling fully energized, excited, and supported through their journey. She's worked with many women and couples over the years at all stages of their fertility journey, whether they are just starting to think about a family or they are currently working at a fertility clinic. When she's not leading women and families into health, Dr. Lisa may be found sipping a good cup of coffee, cooking, and enjoying nature hikes with her teen-year-old daughter. Thank you, Dr. Lisa, for joining us today about this very important conversation about fertility and conception and everything in between. Welcome, and again, thank you for everybody who is joining. Please note that you are in listen-only mode, but you can always post your questions in the comments and we are happy to get to them. So thank you, Dr. Lisa, for joining us today.
Hi, Brianne. Yeah, happy to join and have a chat about this. Yeah, I'm pretty passionate about finding the simplest solutions for women so they can move forward with their health. And when it comes to fertility, it can be really confusing, all the information out there.
Confusing and overwhelming and sometimes conflicting as well. So where is the best place for individuals to start? Like, what would you recommend there?
Yeah, no, that's a great question. I always recommend getting your supports, getting your health team together, and a naturopathic doctor can be a great addition to that team, so we can get some clarity to move forwards. Because some people aren't working with a fertility clinic yet. Some people are just starting to think about conceiving, and then we're kind of scrolling through different information online, and there is tons for fertility. Right? There's a lot of people looking to improve their fertility, and egg quality is something that comes up a lot. So I got really passionate about really clarifying what that is, because really we don't know a lot about it. So
and I think that's a great place to start. Like, what is it? What is egg quality? Who needs to be thinking about this? Is it everybody? Is it based off of age?
Yeah, exactly. So egg quality, basically, if we're going to say one sentence about it to really simplify it, it would be the ability of an oocyte or egg to turn into that healthy baby. That's the best summary of it, because we can't really break it down into anything more simplified, even if we're looking at lab tests or age for that matter. So that's why that's really important.
Is it, like you mentioned, age, is that the only determining factor, or are there other things that can also impact this?
Yeah, lots of other things can determine your egg quality besides age. However, I do have to say age is a big one that impacts it. That being said, I could see a younger woman, so maybe in their early 30s or even 20s, and they could have lower egg quality on testing. So it can vary quite a bit woman to woman at different ages. And also what's really important too is cycle to cycle. We can have totally different egg quality because it's a different egg released each time. So that's something important to remember as well.
And how do you quantify or measure, or how do you know about the quality of your eggs?
So we don't actually have really good measures. There is no definitive test for egg quality or quantity, which is talked about a lot in, the space online and even with your fertility doctor or reproductive endocrinologist. So you'll hear different terms thrown around. And unfortunately, I've even seen, and this is one reason I'm really passionate about this, I've seen people see specialists and they're told, yep, your factory shut down, or nope, no chance you can do this on your own or even with our help. Like, it just completely a blanket statement, kind of shutting down any chance, which isn't even true. Okay, so we certainly have different statistics, and that's what they're kind of going off of. But again, this can vary quite a bit with woman to woman and cycle to cycle.
So if there's not particularly a great way to measure with a test of egg quality, is egg quality determined perhaps more on factors such as diet, lifestyle, exposures, pre-existing conditions, eggs, or how are we actually able to tell somebody, yes, you should have good quality, or hypothetically, perhaps you don't have good quality eggs?
Yeah, that's a great question too. So if you're trying for a long time, so we say more than a year, that's when we're like, okay, we should start asking some questions and looking into things. And that's where having that great healthcare team comes in, so we can have all the information and rule certain things in or out. So that's one sign of having lower egg quality. If you're older, likely it is decreasing a bit over time. If you're told you have unexplained infertility, that could be, it's used a little too often because really we should have ruled everything else out before we say it's unexplained. But that's also a good sign. It could be lower egg quality. Also, if you have an autoimmune condition, that's another good chance that you're going to have diminished egg quality. We have more and more science showing that likely your egg quality could be affected.
Now, what do you do if you've been trying to conceive for over a year, or you've met with somebody that says perhaps unexplained for infertility or egg quality? What is the next step that individuals can take to really feel that they have some control and empowerment to improve this?
Yeah, that's a great question too. So there's lots that we do have control over, and that's a big thing I'm trying to always convey to my patients is and nobody can take away some of these actions that we can take. And one of those big ones is our lifestyle. Okay.
Mhm.
Um, so what we do know, lifestyle, diet, is hard to study, but we do have some solid information showing a few factors that are really consistent, that we can really lean into and take control over. So having overall a healthy diet, having a lifestyle and diet kind of like you're already pregnant. Pretend you're already pregnant. What would you be doing? Those are likely the good things, okay? So if we're getting more specific, that could be the Mediterranean diet. So this is having enough protein, getting enough iron, lots of fruits and vegetables, nuts and seeds. So those are a few tenets of a Mediterranean diet. So we want that really healthful diet. And the other big piece here, and I see this a lot with women, is we don't want to be dieting. We don't want to be, oh, I'm going to do some fasting and I'm going to just have juice this weekend. I'm going to try to lose some weight while I'm trying to get pregnant. It's not a good idea. If weight is a concern for you, I would, again, really enlist the help of a professional, and somebody who has training in fertility as well.
Now,
So that's some of the big ones.
in terms of things that you can add in, you mentioned all of those great antioxidants, the fruits and vegetables, the proteins, the omega-3s. Is there anything that women and individuals should look at avoiding when they're looking at improving their egg quality?
Yeah, probably the biggest one, and a lot of us realize this, but do have to mention alcohol. We have to be pretty careful with alcohol. Um, we do see it reducing success for IVF, for example, for men and for women. So it's one we have to really watch for. It doesn't mean you can't have any. Okay. It's not that you have to have zero drinks, but we have to watch how many drinks in total for a week and how many drinks per sitting. So we want less than 4 a week. And if we're having more than 4 in one sitting, we really see that to be detrimental. So that's one to really be aware of.
And how long would an individual have to practice the changes to the nutrition, removing the alcohol, maybe things like sleep and stress management? For how long do we have to do these lifestyle changes before we can start to see some positive changes?
Yeah, what's also really cool is we can see some of the changes really quickly. So sometimes I'll see people and they're starting a medicated IVF cycle the next week, and there's actually some pretty cool research that we can impact that pretty quickly. Um, that being said, the longer we're doing that, the better. Okay, so the longer we're working on our lifestyle and keeping these things in mind, we're going to have a better outcome. Generally, I'd say 6 months is great. Even when we look at a nutrient like folic acid, which most of us are aware, we should be taking our folic acid if we're trying to fall pregnant. That one's also recommended to be taking 5 to 6 months prior to conception. It takes that long for it to build up in the bloodstream. So that's when a lot of people don't know as well. So
And
we are
how
looking at that time
long
frame.
does it take for individual eggs to develop, right? I believe it's a couple months that they're actively being exposed and growing to our dietary changes and medications and things like that.
That's right. So we actually are born with all of our oocytes. So that's also where when we're talking about egg quality and age, you can imagine if we're born with all those eggs and over time it's exposed to the follicular milieu. So this environment in our body over time, they're going to be affected by our age. That being said, again, yes, when they're finishing that development, those for 3 months prior, 3 to 6 months prior, again, that's what we're really looking at for that last impact in their final development and release.
Amazing. And is there any supplements that you're aware of that has some evidence to support utilizing in the improvement of egg quality or improving the chances of conception, whether an individual is doing that by natural means or supportive techniques?
Yeah, there's a few that stand out. There's not many with great research is one of the main messages I like to put out there as well. So please don't spend tons of money on expensive supplements that you see advertised. There's only a few that we know will have an impact. And you're right, whether or not it's a natural cycle or you're working with a fertility clinic, there's a few that are more impactful. Probably the main one that I see is still really under tested and underutilized is vitamin D. We live in Canada. It's nice in summer. It's summer out there right now, but the rest of the year we're not getting enough sunshine. We're not getting enough vitamin D, and a lot of people still aren't being tested, even if they're trying to conceive. So we really need to know our baseline levels of vitamin D, and we need to be taking enough to be healthful and have that good fertility, and it should be part of our prenatal workup. And this nutrient is the only one that we know does impact egg quality. So that's kind of cool. So you can see how important it is. It actually influences AMH. We have some good research on that now.
So it almost seems if you were thinking about conceiving in the next 6 months or so, or even a year from now, looking at the things that you can do, especially if that falls within the winter season of North America, wherever you're located, ensuring that you're having that testing as well as supplementing with the appropriate dosaging for at least those 3 to 6 months. What
Yeah,
about
that's right.
something like a prenatal vitamin? Is that something that individuals should be considering adding in prior to conception as well?
Yeah, prenatal vitamin can be great. Within that prenatal, the most important thing is the folic acid. So if you're just going to take one thing, it would be just folic acid. We do have a bit of the vitamin D and a couple other things that might be helpful in that prenatal. So generally, yes, I do recommend taking a prenatal, but at minimum, it's that vitamin D and folic acid that we're really looking for getting the optimal dose of.
So vitamin D, folic acid. Is there anything else that has any sort of research on it when it comes to supplements or things that people might consider taking? I hear things about CoQ10 and melatonin. What are your thoughts there?
Yeah, there's a few others, and those are two definitely that are talked about more. For sure, CoQ10, there's been a lot of conversation about that over the years. And if I don't recommend it to a patient, they're always asking about it. And we did actually do a lot of the research here in Toronto, which is kind of cool. What's not as helpful with CoQ10 is, in conclusion from all that research, we saw more pregnancies happen, but the goal isn't just to get pregnant, right? We want to have that healthy baby result, and it actually wasn't improving live birth rates. So that's where I say, you know what, if we're just going to try everything and you got the budget for it, great. Take the CoQ10 under certain circumstances, which again is where a health professional comes in to make these recommendations. But it's not going to be top of my list for most people with that. And yeah, then there's melatonin, which actually we have better research for. And unfortunately, a lot of women aren't aware of, and they're actually, I find some of them are even scared to take it. They feel like they're going to get dependent on it, that's going to do some harm. And they're pretty surprised to hear that it can impact our egg quality. And this one actually can result in more live birth rates. So actual getting that pregnancies and more healthy babies.
Now, do you find, I know this is like maybe a personal question, but do you find that the supplementing with melatonin, if an individual is sleeping well and they've got really good sleep hygiene, that it still has benefits? Is there any insight that you have there? Is it more the sleep hygiene that's important, or is it the actual additional dose of the melatonin?
Yeah, so it's that's true. It's both. So I'm definitely going to recommend it if there's sleep in there as well. But I'll always write it in a patient's plan that we're taking this for your fertility and for egg quality. It's not just for sleep, even if sleep is one of the side benefits, which it often is. If we have better quality sleep, that's going to be great because we know how important that is towards our overall health.
Perfect. Last question here before we wrap up, before we go. What is the best takeaway tip or resources that you can recommend for individuals who are listening? If they have questions about improving their egg quality, fertility, what are some great resources where individuals can access additional information?
Honestly, there's some good resources online. It really needs to be, my best recommendation is to get assessed, to work with professionals, get assessed personally, because we all have a different health history. We all have different things going on. And the other big piece is we have a partner. Generally, we have a partner in this, right? There's a second set of genetics. We need to know that person's health and know what's going on with them too. So we got a 50-50 process. So get assessed, do this with your partner, make it a team effort. It's not just about the woman's egg quality, even though that is a good 50% of it. So getting assessed is the best way to get personalized information. And that's probably the biggest thing, right? Like get the right information, take care of yourself, do these. It's not as, exciting a topic, but it's your general health things, sleep, eat well. Those things we do know are going to have an impact over time. So keep that in mind.
And I love how simple you made it with the statement where you said, live like you're already pregnant. I think that's
Yeah.
a great piece of advice when you're looking to conceive.
Yes. Yeah. I'm going to sum it up. That's probably it. Pretend you're already pregnant. Do things that make sense for your body, considering that, and you will have an impact on egg quality and get the help you need. Ask the questions.
Amazing. What is the best place for individuals to find more information about you and your practice?
Yeah, so on lakesidehealthcenter.com, you can find information about me and my team and how we support women and families in health. So that's probably the best place to go. I am on Instagram as well. It's Dr. Lisa Adams. And so you can check out some more information there and connect with me.
Perfect. Thank you so much for joining us today, talking about nutrition aspects to improve egg quality, supplemental aspects to improve egg quality. We will post all of the social media as well as website links for Dr. Lisa for everybody who's interested in contacting you and learning more. And again, I appreciate you coming today and everybody for showing up to the webinar this morning.
Awesome. Thanks for hosting, Brianne.
Thank you. Bye now.